Hello, everyone, and welcome. My name is Samuel Schallenberger. I am the Assistant Director for Orientation and Student Development here in the college, and we are so happy that you're joining us today. Welcome or welcome back to our summer webinar series. Today, we are going to be talking all things student wellness, and I will be serving as your moderator today. The first 30 minutes or so will be dedicated to a presentation from our campus partners regarding student wellness, hopefully getting all of those questions that you may have answered. If it does not, we are utilizing the Q&A function. So if you have something in particular that you don't see in our presentation today that you want to know about, you can utilize that Q&A function towards the bottom of your screen, and we will have a Q&A portion towards the end of our time here today that you will be able to submit any of those questions, and we will be able to reply to them directly. Today's webinar is being recorded, as with all of our summer webinar series, so we will have that posted on our website shortly. I will send a link to where you can find those towards the end of our time. So if you do need to step away or just want to hear something again, feel free to visit that towards the end of our time. But I'm going to go ahead and pass it over to Student Wellness as I pull up today's presentation.
Thank you. Hi, everybody. Thank you so much for being with us today. My name is Elizabeth Webb. I'm the Director of Health Promotion at UChicago Student Wellness. And while the slides are being pulled up, I'm going to let my colleagues introduce themselves. Celia, do you want to start?
Hi, everyone. My name is Celia Bergman, and I am a program manager within Student Wellness. One of the programs that I help manage is the student insurance program, which I'll be talking about in a few minutes. And I'll turn it over to Karina.
Good afternoon. My name is Karina Bauer. I am a clinical psychologist at Student Wellness for counseling. I've been here for about 5 years, and in the past year moved into the role of assistant director for access management, which really means I'm here to make sure all students have access to our services, and if they run into any trouble, help them navigate it.
My name is Andrea Magana. I am a nurse navigator here in the Student Wellness Center. I've been here about 4 years, and I do just as my title kind of states. I'm a nurse navigator. I help students navigate the complex world of care while they're here at the university.
Thanks, everyone. And we're just here to tell you, as Samuel said, all things about student wellness. So we will have time at the end for questions, but please feel free to ask questions as we go along. And we'll answer them to the best of our ability. So UChicago Student Wellness truly is here for students. We really mean that. We are here for you. We are here to help you. When it comes to where we are physically, in 2020, we opened a really beautiful state-of-the-art wellness center that is pictured here. All of our staff, so our medical staff, our mental health staff, and our health promotion staff are housed here. And we also have 2 health insurance reps on site to answer questions that you might have. Highly recommend taking a picture of this screen or a screenshot. It's really helpful to have our address and our phone numbers here. If you do need to contact us during business hours, you can always call the 773-834-9355 number. When you call this line, you can learn about more of our services or access any medical, mental health, or health promotion service that you might need. So you can make appointments that way. Also, if you make or if you need assistance outside of our business hours, you can utilize the after hours numbers, which are listed here as well. So we have a 24/7 nurse line. We also have a therapist on call service. That's that 8181 number listed there. And then before we take a look more in depth at the 3 functional areas that I mentioned within student wellness, Celia is going to talk to you a little bit more about health insurance, the health insurance requirement, and the university health insurance plan.
All right. Yes, the university does require that all full-time students registered have adequate health insurance. And UChicago Student Wellness does administer what we call USHIP, or the University Student Health Insurance Plan. And this plan obviously meets the university's requirement. USHIP is a high quality option and is actually selected by over half of our students. Each year, all registered students must either enroll in USHIP or waive by providing proof that they have adequate comparable coverage. And again, this is a yearly requirement. Students will receive email reminders from Student Wellness when it's time to take action to enroll or waive USHIP for the year. Next slide. So this coming fall, the deadline to waive USHIP is October 18th. And after that date, students who did not waive will be automatically enrolled in USHIP, and the premium charge will remain on their student account at the university. So this means that if you already have alternate coverage and don't waive, you'll be paying double. So please don't forget to waive USHIP by the deadline if you have alternate coverage. The list of comparable coverage requirements for alternate coverage can be found on the student insurance website listed at the bottom of the slide. And if you want to keep USHIP, we recommend confirming your coverage when the enrollment waiver site opens, which will be in early August, so that you can access your USHIP benefits as early as September 1st. So the USHIP plan provides coverage for a full year from September 1st through August 31st. So it covers an academic year. As the slide indicates, we have 2 United Healthcare insurance coordinators who are available on campus. They sit in the Student Wellness Center, and they're available to answer any questions you may have about USHIP. And you can contact them via email or the phone number on the screen. And also, answers to most of your questions related to USHIP can be found in the FAQ, which is on the student insurance website, listed at the bottom of the slide. The next slide talks about the student services fee. So students who are actively enrolled in an eligible program of study at UChicago will pay a quarterly student services fee, and that fee covers a majority of services provided at UChicago Student Wellness, in addition to other services on campus. So this means that most medical services, all counseling and psychiatry services, and all the health promotion programs are provided at no extra out-of-pocket cost for students who pay the student services fee. There are a few medical labs that may be billed to your insurance, but your medical provider will discuss this with you prior to receiving any care that might incur a charge. It's important to note that you do not have to be on USHIP to utilize the free services from Student Wellness. Any medical services that are billed to insurance can be billed to any insurance, not just USHIP. And just as clarification, most full-time programs that convene on the Hyde Park campus are considered eligible programs for utilizing student wellness. And students are also eligible during the summer if they are still enrolled in a full-time program, that meaning they haven't graduated or taken a leave of absence. The next slide talks about our wellness portal. So at UChicago Student Wellness strives to make it convenient for students to make appointments, to communicate with their clinicians, and to access their own health records. So we're pleased to announce that we have an integrated health record system for all of your activity with UChicago Student Wellness. We refer to it as your wellness portal, and all incoming students for autumn should already have an account. This next slide has a short demo of using the portal.
My Wellness Portal allows you to schedule appointments, submit immunization records, and message student wellness providers and staff. You can navigate to My Wellness Portal from wellness.uchicago.edu and log in using your CNET ID and password and verifying your date of birth. From the home page, you can schedule an appointment using the Schedule, Check-in, or Cancel an Appointment button. The pages will guide you through prompts so that you schedule the appointment that is best suited for your concern. To fulfill your required immunizations, click on Medical Clearances on the left. There are 2 steps to complete your requirement. First, upload all your immunization documentation using the Update button next to Immunization Record. Then, use the Update button next to each immunization and enter in the dates you received each immunization. Please allow 14 business days for the review of this documentation. You can also update your preferred name, pronouns, and other information by navigating to the Profile tab on the left menu. We look forward to seeing you soon!
So as you can see, this integrated platform allows us to facilitate comprehensive, holistic care, and it has many convenient features, including the online appointment scheduling, single sign-on using your CNET ID, and you can use secure messaging with your clinicians. In addition, through your wellness portal, students are able to schedule many types of appointments online, submit required immunization records and consent forms, view and print your immunization history. You can communicate securely with your UChicago student wellness providers, self-check-in via your mobile device in the Student Wellness Center, and you can also complete intake forms and health histories through the wellness portal. And I will now turn it over to Andrea.
Andrea, you're muted.
Of course I am. So we are now going to discuss each of the three functional areas within student wellness. The first functional area we're going to discuss is medical. Our medical team is a diverse and interdisciplinary team of doctors, advanced practice nurses, medical assistants, and more. Our clinic provides primary and routine medical care, providing services such as physical, screenings, and more. We provide a variety of immunizations, including those required by the state of Illinois, as well as flu shots during the autumn quarter. We provide acute care health. This includes concerns such as sprained ankles, ear infections, among others. We provide sexual health services such as gynecological care, contraception, HIV prevention consultations, sexually transmitted disease infection testing, emergency contraception, along with other services. We have an interdisciplinary treatment team that can assist with complex issues such as eating concerns. And in addition, we have nurse navigators such as myself who assist in navigating healthcare should you need it. Next slide. We are an appointment-based clinic, so we request that you make an appointment in advance of coming to the Student Wellness Center. You can do so by scheduling an appointment in the My Wellness portal, or if you don't find something to your liking, you can always call us at 773-834-9355 because all of our appointments are not always listed on the portal. We know that we know that you don't always know if an ailment or sickness arises in need of a doctor's visit, and that sometimes you just need to seek some medical advice or nursing advice. And if this is the case, we encourage you to call the 773-834-9355 to speak to a member of our staff during business hours or after hours for medical advice or just some good nursing care. In addition, we know that the emergencies sometimes happen. If we do not provide emergency services we do not provide emergency services at UChicago Wellness, but they are offered in our partners at UChicago Medicine and also UChicago Medicine Urgent Care Clinics. In the event that you are unsure or if you have a concern that is an emergency, please contact us for assistance. And as a reminder, our medical services are covered by the student service fee and are not charged to your insurance. So you do not have to be on USHIP to use our services. Although some services will be billed through your insurance if they require external processing, such as some labs. Visit our website or ask your provider to learn more. As you prepare for the academic year, here are a few things to keep in mind. First, if you'd like routine health care on campus, we recommend establishing a primary care provider with one of our physicians or nurse practitioners. You may do so by scheduling a physical once arriving to campus. Per Illinois state law, all students are required to submit proof of immunizations. You may make immunization appointments with the Student Wellness starting the first week of August. Be sure to submit your required immunizations to the My Wellness portal by October 25th, 2024. If you are currently on medication, please plan to bring 3 months supply of medication to campus. If you cannot do so, transfer your prescription to a Chicago-based pharmacy before leaving home. Not all of your prescriptions that you get from your home doctor, we would be able to help bridge that prescription if you find a new doctor here, so make sure you bring your medicines with you. If you need help transferring your prescription, please get in touch with a nurse navigator, such as myself, at UChicago Student Wellness by calling 773-834-9355. If you have a chronic illness and need assistance in managing it, such as finding a specialist here in Chicago, please make an appointment as soon as you arrive to campus to make your treatment plan for your time at UChicago. Okay. As we mentioned earlier, the university requires all students to be up to date in their immunizations and to provide proof of this. The deadline to submit this is October 25th. If you need to receive required immunizations, we do offer them here at Student Wellness. Incoming students may make immunization appointments starting the first week of August. We will also hold 2 walk-in required immunization clinics at the beginning of the academic year on September 28th and October 12th. Appointments for the weekend clinics will be open closer to the clinic dates. And this is a good slide to maybe take a screenshot of. Letitia Bennett at letitia.bennett@uchicagohospitals.edu is our immunization whiz, and any immunization questions should go to her. As you prepare for the academic year, we do encourage you to bring some of the basic medical supplies such as thermometer, rapid COVID test, ibuprofen, Band-Aids, antacids, and other items for daily and first aid use. A nice little first aid kit would be very, very handy. That's it. I'll turn it over.
Okay, so moving on to mental health care services. UChicago Student Wellness offers high-quality, accessible, and culturally sensitive mental health care to address a wide range of concerns for students. We have a diverse staff of psychologists, social workers, psychiatrists, psychiatric nurse practitioners, and advanced trainees. Can always go on to kind of our website and see kind of everybody's profile and pictures to verify that. At Student Wellness, we offer brief individual and couples counseling. And when I say brief, there's not a set number of sessions we'll see a student. It's really when a student comes in and works with a therapist, they collaborate and decide together what kind of services look like. But we do not offer long-term ongoing services for students. If a student knows they're really looking for ongoing services, we have a really robust referral service list. We have a lot of great providers we work with in Hyde Park, downtown, who provide virtual services. And we have 2 case managers on staff who can help a student kind of get connected, especially if they have maybe a less familiar insurance or things like that. So we really support students in getting connected to the community if that's something they're looking for. We also have a psychiatric team on staff who can assist students with medication management. And these services for us are long-term, meaning if a student connects with a psychiatric prescriber, they can see that prescriber their whole time here as a student, and those services are free. Please note that when a psychiatric staff meets with a student, they work with the student to do their assessment and come up with a treatment plan with them. We also offer a lot of other services. We offer group therapy at the center, and that can be virtual or in person. I think this last year we had a grad process group, an undergrad process group, a group for students struggling with health concerns. In the past, we've had an international student group, a student of color group, and kind of whatever kind of the needs are the students, we try to meet that by offering groups for them. We also offer something called ASAP, and that's the Academic Skills Assessment Program. And that really aims to help students improve their academic performance. If they're struggling at all, they would call or email to make that appointment and have an assessment with a provider, and then probably follow up with some short-term coaching and referrals. Something else that we offer that I think is a really great service is Let's Talk. And that is a service where it'll be kind of every time at the same week in in a location kind of outside of student wellness. So maybe at the business school or at other places in a discrete location that's advertised. So students can go in and it's completely confidential and anonymous and they can talk to a therapist. And sometimes that tends to be kind of the bridge to get students into counseling if they're a little bit hesitant or unsure. It gives them kind of some space to explore that with a counselor. And in addition, we also provide workshops as requested by students. Okay. And then the next slide is accessing mental health care. Students can schedule an appointment simply by calling us. We're open Monday through Friday, 9 to 5, and they can call and just schedule an intake appointment with a therapist. Students are also able to go on the student portal and make their own appointment. And that can be kind of a nice service because they can go on the portal and take a look at all the providers, see their profile picture, and kind of pick an appointment time that works for their schedule best. And we find that I think students' most preferred time to make those appointments tend to be at 3 a.m. So that kind of works. If something comes up and they're feeling it's the right time, they can do it at any time. Students who need to speak to a therapist urgently can call our therapist on call. And if it's during kind of our 9 to 5, it's our regular number that's listed here. We have a therapist on call, Yael Hoffman, who's amazing and works with students who call or come in anytime they're having a concern. And then we also have on-call services 24/7, 365 days a year. And that's kind of the number kind of in bold there. So if a student has a concern, they're always encouraged to call and kind of talk to a provider. I think as Celia said, our services are covered by the student service fee. So they are free to eligible students. All of our services are free and confidential. And then another service we offer on the next slide is Timely Care. And that is our teletherapy option for students. I believe we started this last year and it was I think a great success and heard a lot of good feedback from students. It is a teletherapy option for students. I always recommend when students come to campus, please download the app Timely Care on your phone, kind of so it's there and easy to use. And it offers a lot of different services to students. It offers, I think, a great service, Talk Now, which is really a service that if a student's under stress, they can just kind of go ahead and access Talk Now and talk to a provider. I find a lot of students reach out to Talk Now, maybe for a breakup or if they felt like an exam didn't go well, if they're homesick, and it really just gives them that kind of in the moment support. Timely Care also offers scheduled counseling sessions, and a student is able to have 12 free sessions a year. And that's a really nice service, is if they're interested, they can go onto the app and find a counselor that kind of feels like meets their needs and just set up an appointment. And once they meet with that counselor, they can continue up to 12 times during that year. And like it says in the slides, it resets annually. It's a great service in terms of it's such a wide range of providers in terms of languages they offer, availability during the day. And a lot of times I recommend it because if a student goes home, maybe they go home to Florida for the summer, it's something they can access out of Illinois. It's available to students in all states. Timely Care also has psychiatric services, and those are available and free to students. Typically, if a student gets referred to Timely Care for psychiatry, it's usually through one of the therapists at Student Wellness. We tend to kind of monitor that because we have a limited number of spots. And since it's telehealth, there's some restrictions. They don't prescribe some controlled substances. So we tend to here kind of really make sure it's a good fit for a student if we refer. They also offer health coaching, some self-care content, and just tons of things. So I always encourage a student kind of to be able to explore it and kind of know what's available to them. Okay. And my last slide is preparing for the academic year. I know this can be a really stressful time for parents and students when you're going to go ahead and transfer your care to UChicago. And we always just recommend whenever a student arrives to campus, if they know kind of they want to continue their counseling services or their psychiatric medication, when you arrive, just call us or go onto the portal and make that initial intake appointment with a counselor. Once you have that appointment, the counselor will help connect you kind of to other services, maybe a psychiatric appointment or kind of whatever other resources are helpful to you. We really try with intakes not to book out past 5 days. So I know sometimes students get nervous and want to make the appointment like in July for September. Please know we'll have availability then. And if there's an issue, we always work with students to make sure we get them in. So there's no, difficulty around not having medications or having services. In terms of medication, if you plan to continue treatment with your current provider, please arrange to bring a 3-month supply of that medication if possible. Similar to what was said before, consider giving your prescriber the information to some local pharmacy here in Chicago. We have kind of two really close by. And then same for therapy services. If interested in scheduling an initial counseling appointment, please know the portal is great for that, or calling, and one of our wellness coordinators we'll get a student set up. And then always recommend coming to our student wellness open house on September 24th. You can kind of get to meet us all. Usually they have some good cookies and other treats, and really nice just to see our facility and get to meet us.
All right, so the final area that we're going to be talking about today is health promotion. So our health promotion team is actually made up of both staff and students. And so our health promotion programs and services are really just designed to help support students and their well-being by meeting them where they are. Our health promotion team approaches health and well-being from a really holistic and inclusive approach that includes our 7 facets of well-being that are listed on this slide. And really, we try to just make sure that students are well within each of these areas. So emotional, physical, but also spiritual, financial, intellectual well-being, these are all really interconnected and equally important. So with that being said, we also have an array of programs on the slide here. This doesn't encompass all of them, but it's quite a few of them. So while you're here, we really encourage you to take advantage of some of these because, again, they're completely free for you to use. So you can learn techniques to reduce your stress or anxiety through programs like art therapy, mindfulness meditation courses, or restorative yoga. We can teach you how to learn to recognize warning signs and symptoms of a mental health crisis, and just really how to be there for and support your peers with our Maroon Mental Health Matters training. You can have one-on-one conversations with a trained staff person about your alcohol or substance use. You can also identify ways to sleep better, gain more restful nights through our virtual Refresh Sleep program, which is an 8-week course online, sort of at your own pace. You could also build community on your recovery journey through the student recovery group. And then we offer safer sex supplies at all of the dorms, at Student Wellness, and all around campus. So feel free to check those out. You can also order specialty products from us if that's something that you feel like you might need. And then we always encourage students to get involved with us. So we have a variety of student groups. We have an advisory board. So if you're interested in getting involved in student wellness activities, please reach out. So again, a lot of the programs and services provided by health promotion don't require appointments, but for the very few services that do, you can see us on the portal, similar to what everyone else was saying, or give us a call. And we really couldn't do the work that we do without our passionate students. So again, if you're interested in getting involved, please let us know. And just note that all programs that we provide are completely free to students. So all of the mindfulness classes, the yoga, the art therapy, it's all completely free. And oftentimes just like a quick registration or even just a drop-in. So as you prepare for the upcoming academic year, we really just encourage you to take a look at all of the health promotion events that will be offered, particularly in autumn quarter coming up. And you can do so by reviewing the student wellness calendar. So we have a QR code for you here, so you can go right to the student wellness calendar. We also really recommend that you take a look at the incoming student checklist, which was in your online module. So you should have already seen that, but if you haven't, it's listed here for you as well. just take a minute to look at that. Some of the things will be repeated from what you heard today, but always really good reminders. And then just, being proactive, making sure that you're saving our numbers in your phone, making sure that you have us in your back pocket when you need us. And then finally, just when thinking about staying well at UChicago, we just have a few last minute tips for you. Again, just being proactive about your wellness. Identifying your personal needs and developing a plan can be a really great way to come into your first year here. Connecting with other people. So talking to people you trust and who can support you. Social support is a really important protective factor for your well-being. And I think particularly important when transitioning to life at UChicago or just any new place. And then seeking professional support. So reaching out to student wellness and other campus resources that you will all hear about, I'm sure. Just remember that seeking help truly is a sign of strength, and we are here to help you. So reach out to us when you need us. These are just some final QR codes for you to connect with us on social media as well as our website. Again, attending our open house on the 24th is a really great way to come in and ask more questions, get to know us. You might be able to do immunizations at that open house, TBD on that, but hopefully. So there's some great ways for you to get involved, even make appointments if you need to. So from 3 to 5 on the 24th, which I believe is a move-in day. So you should all be here by then. And then these are just some specific folks that you can reach out to, many of whom are on this call with you today. But if you have questions about immunizations, you can reach out to Tish, counseling, Karina's here, insurance questions, Celia, or getting involved, please feel free to reach out to me. But honestly, if you reach out to any of us, we'll get you into the right hands, no matter who you reach out to. And then we'd love to open it up for more questions if you have any. If there are certain things that you might still want to know about student wellness or just wellness in general in order to help you be successful during your time here.
Looks like we have one question about services under psychiatric services that are offered. Anyone wants to elaborate on that or circle back a little bit?
I can just share a little bit. So if a student comes in and makes an intake appointment with a counselor, the counselor will be able to refer them to psychiatric services, whether that is kind of with us in-house, timely care, or maybe to the community if that feels like a fit for a student. But in terms of in-house, the services are long-term, they're free for students. You'd obviously have to use your insurance to, when you pick up your prescription, but there's really no limits. They see students kind of for all concerns, ADHD to bipolar to psychosis. We have an incredibly skilled staff who really, work with students in all circumstances.
Awesome. And I see that some of our questions throughout the presentation have been answered. So if you're watching and want to see any answers to those that have already filled in, please feel free to scroll through those. We have a couple that were also submitted through our registration form. So if you have more, please submit them through the Q&A function, but I will toss out a couple of these that we got in advance. First, having to do with allergist options. What is the best contact for detailed questions about allergy shot administration, allergist questions at the university?
Mhm. So we do administer allergy injections here in the clinic. We just revamped our whole program, so it's safer for the student and for us. So if you can just send me an email, amagana, it's the first letter of my name, my last name, the number 1 at uchicago.edu. Send me your questions and I'll be happy to answer those. Usually what happens is we communicate with the outside allergist, make sure you bring your serums with you, they fill out some paperwork, you fill out some paperwork, and we'll be able to get your allergy shots here.
Awesome. Thank you, Andrea.
Mhm.
And then any advice on the health promotion side for incoming students about a healthy work-life balance, kind of navigating that as a first-year student? Does that fall under your purview at all? And what advice do you have?
Oh my goodness, that is a big question. Anyone else feel free to hop in, but I would say, again, sort of thinking ahead is really important. I think a lot of us, to some extent, know what we already need, what makes us happy, what helps us, get through tough situations. And so if what has helped you in the past, I think thinking ahead to what could maybe help you in the future is a really good start. And also thinking about balance, I think it's important to make sure that you do make space for that and make sure that you're keeping time to, spend time with your friends, meet new people. It's going to be a lot going on at once. And so I think it's, always good to know that, yes, you're here to study, you're here for school, but, some of those other either extracurriculars or things outside of class are really important too, to help you keep balance. And I think getting fresh air, making sure that you get sleep, making sure that you're eating well, those things are all really important. I don't know if Karina, you have anything to add as our therapist in the room.
Oh, I always say just to normalize that transitions are tough and it's okay to come to the university and be really excited, but get here and feel a little sad, overwhelmed, or have some trouble making friends, or having a tough time navigating kind of classes for the first bit. I think there's so many Hollywood movies where people walk in and they're like all of a sudden in love with their roommate, it's their best friend, or the guy down the hall is the one. And that is, a great kind of image, but it is, transitions are tough and it's okay for them to be tough and to feel like they can ride through it.
I guess just to piggyback off of that really quick, I think a lot of people don't always talk about it. And so you might think everyone around you is doing really great and not struggling at all, but a lot of people feel the pressure and can feel stress and even lonely at times. And so even if other people aren't saying it, you're not alone in that. A lot of people experience that during a big transition, especially.
And I would say stay off of WebMD. If you have any sort of concern or feel ill, just give us a call. We're credible, I promise.
Awesome. Well, that is what we have on our Q&A side so far. Anybody wants to sneak in one last question? But if not, I want to thank all of our panelists for being here with us today, to all of our participants for viewing. I'm going to go ahead and throw the link in the chat one more time for everyone so that you can go ahead and look at our past recordings. This is also where today's webinar recording will be posted shortly, and where you can find all of our upcoming summer webinar series events. So you can go ahead and register for those and get them on your calendar. But in the meantime, thank you each so much for being here. We really appreciate it, learning all about student wellness today. And I hope you have a wonderful rest of your days. Thanks, everyone.
Thank you.
Bye.